Friday or so ago, I was in Newark at the Newark Senior Center, and I was there to urge senior citizens to join the rest of us and a bunch of senior citizens all over America to help us reduce the loss of money from the Medicare Trust Fund due to fraud. A lot of crooked people out there trying to steal money, not just from senior citizens, but also from our Treasury, from the Medicare Trust Fund. What we're asking our senior citizens to do is to join the Senior Medicare Patrol, be part of the eyes and ears to help us ferret out fraud in Medicare. And I thought it was good, good exchange, good presentation, good question and answer. And as it turns out, the heart and soul of the healthcare reform legislation is something called the exchange. In fact, we're going to have 50 exchanges, which are large purchasing pools, one established in every state across America. And into that purchasing pool, people who are individuals or families or small businesses, even mid-sized businesses, can participate, create a larger purchasing pool, buy their health insurance from a larger purchasing pool, drive down the price, get a better result for that money. And when the exchanges are created and stood up in 2014, that's what we have to do. We have to, by law, senators, representatives, our staff, buy health insurance through the exchange, private plans that'll be competing for the right to sell insurance to all of us through the exchange. If Delaware wants to enter into a interstate compact, when we stand up and establish our exchange, we want to stand up and have we'll say an interstate compact with Maryland or New Jersey or Pennsylvania or some other state to create a larger purchasing pool, we can do that. But when we enter those interstate compacts with those other states, insurance sold in one state will be sold in another. Oh, we have some new tools in the new law. One of the best tools is actually when we comb through the information, like mine the data, if you will. We actually find clues that suggest maybe fraud is occurring. In some cases, it can be doctors ordering, providing services for people who don't exist, doctors that don't exist, like they're phantom doctors. In some cases, they're ordering medical equipment for people that don't exist, and they are maybe already deceased. So we provide a number of good tools that will enable us to identify those patterns of fraud and to be able to go out and shut it down. And the other thing that we do is we have the ability to go out and, whether mispaid money, we made mistake payments are like $50 billion last year just in improper payments in Medicare alone, for us to be able to go out and recover the money. And the money that's recovered goes back into the Medicare Trust Fund. So there's a number of things that we can do. One of the smart things they do in credit cards, and this happened to my family recently. My wife was going to go to India, where our son was living for a while, and she allowed him to use her credit card, and in India, and it sent off alarm signals that our credit card company said, well, who's this using this credit card in India? They shut it down. And as it turns out, they probably should have, but it was actually a legitimate purchase. We need to be able to do that with Medicare. When you see patterns of consumption of health care that really are so different from a person's profile, whether it's equipment that's being ordered, pharmaceuticals that are being ordered, treatments that are being provided, that should send up some warning flags. And under our new legislation, it will. The question of what should we start on first? Do we start trying to clamp down on the fraud, or should we go in and try to do some major changes to Medicare? As it turns out, we're doing both. And one of the things that we're doing is doing a number of things that will ultimately enable us to get better results for less money. I am an old naval flight officer, and for gosh, almost 30 years of my life, I received annual physicals from the Navy on my birthday month, in my birthday month of January. The reason why the military spends money on annual physicals is to catch problems when they're small. We also have a lot of people who take medicine in the Medicare prescription drug program, and sometimes their eligibility runs out during part of the year. We call that falling into the donut hole. And so people stop taking their medicines, they get really sick, they end up in emergency rooms, they end up in hospitals. It's not very smart, and the pharmaceutical companies are going to help us close that donut hole starting actually this year. And the likelihood that people will stop taking their medicines, that's going to be reduced. So we're doing some things like that, and also co-pays for like colonoscopies and, oh gosh, mammograms, prostate screenings. We have had these co-pays in the past, and really keep people from getting these preventive care and the ability to detect problems when they're small. So all that's changing. The thing that runs through all of them is better outcomes for less money, better healthcare outcomes for less money. And while we're doing that, we're going to try to make sure that those crooks that are out there trying to steal the money out of the Medicare Trust Fund and take advantage of our seniors, that they're going to find it more difficult, and we're going to be more likely to catch them. It's a Medicare senior patrol. And there are hundreds, actually thousands of seniors all across America who are joining us in an effort to clamp down on fraud, help us identify, look at their Medicare statements every month when they get these billings, see does something here look untoward or inappropriate. If they see things or hear things, they report it, and we can stop it and nip it in the bud. So the Senator Carper and I are like the two senators, but we've got a great army of volunteers out there, and it's an army that we want to grow.